Hello and welcome to your last lecture for the semester of 550. And our topic today is how do I write a good research question? Notice our housekeeping items, just be aware of what's coming up and when, and what we're doing for the rest of the semester. Also, we're going to be doing the course evaluation. If you complete the course evaluation with 100% class participation, it will be equal to 1 extra credit point on the final exam for everyone, and I will bake you cookies. So, in writing the research question, we have to be aware of all the parts that are introducing our methodology. So this is the point that we're at. We've gone through the literature review, we've explored the literature, and from that we have now surmised a problem, a gap that exists, an issue that exists, perhaps an intervention that needs to be created, and there's some sort of an absence there that we need to address. This is what we call the research problem. So there should be a succinct, perhaps 1 or 2 sentence statement about what exactly the research problem is. We will have explored it in depth in our literature review, and we're going to sum all that up toward the end of our literature review in our summary of that, and that's going to be our research problem. So what we want to do when we are writing our research question is we want to start broadly, as we know, kind of going back to the very beginning. We investigate the literature with that background question and foreground question. And then as we're coming to narrow it more to the focus of our particular research, we want to state it succinctly. We want to derive it from practice. Now, that doesn't mean that it has to be specifically an intervention focused or even an assessment focused. It can be focused on understanding our patient population better, but it's derived from a question that we have in practice. Now, from there, it needs to be informed by the existing scientific literature. We shouldn't be just kind of pulling this out of thin air. We should be formulating our question based on what we know about the problem so far. But we need to be taking a new twist on it. We need to be doing something that's somewhat innovative and that has a potential for a high amount of impact on the profession and on the clients that we seek to serve. So here's an example of a research problem. People who are hospitalized with serious mental illness tend to be re-hospitalized at a high rate. So maybe this is something that we noticed in practice, and when we investigated the literature, we found that it's also documented in the literature. So now we're going to move on to our research question. This is going to be a little more narrow than the problem. The problem tells us sort of what exists out there broadly, what kinds of things are going on that we've investigated that's kind of honing in on the topic that we want to investigate. Our research question and our research purpose statement are going to be much more narrow and focused and specific. And this is going to be intended to generate a very specific form of knowledge. And we'll talk about this a little bit more as we go on. But we want to generate a research question in such a way that it can be answered by our study, which means that we may be only looking at a piece of all the things that we want to know. Sometimes researchers, and I know I'm guilty of this, of when I was a brand new researcher, I wanted to do everything all at once in one study and answer all the questions that I had. Can't be done from a research perspective. You have to be able to take it off in small chunks. So then what you have is a research agenda, a series of studies that you're going to be pursuing over time to answer some of the broader questions that we have in practice and the knowledge that we want to generate in practice. So here is a research question example. So we had our problem of people being hospitalized with serious mental illness, and then we're going to make that question much more specific. Is functional level related to the frequency of hospitalizations over a 3-year period in persons who are hospitalized with serious mental illness? So you can see how that is a much more focused question than just people tend to be rehospitalized. It's getting at what's the functional level, like what are the gradations of that? And we're looking at a specific time period, this 3-year time period. So then we're going to take that question and turn it into a research purpose or a research aim. And this is going to describe the purpose of the study and how it intends to accomplish answering the question. Okay, so here we go. We have our problem that we previously stated, our question that we stated, and then now I'm going to say the purpose of the study is to investigate the correlation between rehospitalization rates and functional levels in persons with a diagnosis of severe mental illness, and I'm going to use a retrospective analysis of hospital record data in order to do that. So, let's take it one step further, and we're going to hypothesize about what we're going to find in this research study. So this is a carefully written phrase that definitively describes the expected outcome of a study. Now, the research hypothesis, or sometimes called the alternative hypothesis, states what you think will happen. A null hypothesis states what would happen if there were to be no change. So there would be no difference, in rehospitalizations based on functional level. Not all studies have a hypothesis, especially qualitative studies. Qualitative exploratory studies may not have a hypothesis at all because you're trying to find out what is. So you're not guessing at what is, you're trying to keep an open mind. In fact, to go into it with a bias of a hypothesis may be contraindicated to the type of study that you're trying to carry out. So here's them all laid out again, our problem, our question, our purpose, and now we've added a hypothesis. The authors hypothesized that lower functional levels, as measured using the CARE tool and the MOCA screening tool, so now we're bringing in assessment tools with it, will correlate significantly with higher rehospitalization. So we've developed it into what we think is going to happen and let our readers know up front as we are preparing our research methods what we are expecting to see. So there are types of research questions, kind of going back to that research questions. Some of them are descriptive, and this might be more in the qualitative realm of things, where we're looking at describing what exists. So these are polls, survey, descriptive data, qualitative data. Another type of research question is relational, and this might look at the relationships between two or more variables, for example, demographic data and outcomes. For example, does gender matter in terms of which political party a person votes for? By the way, I think the answer is no to that. But that's the type of question. Does region that you live in matter when it comes to the type of intervention that people are providing, that occupational therapists are providing for stroke patients, for example? So is there a relationship? It could be a correlational, or it could be a difference between groups. So that's the relationships that we might look for. And this is where we can get into our quantitative studies, our t-tests, and our non-parametric versions of t-tests. What is the relationship? Our correlational studies, those sorts of things. Now, these things are actually kind of go in tiers. A relational study is going to have descriptive data behind it, whether it be from a previous study or it might include some descriptive data in the study, okay? The final type of research question is a causal, not casual, but a causal relationship. Is one variable causing another? And as we talked about when we talked about correlations, you can't have causation unless you also have correlation. So it kind of goes in stair steps, right? If we're going to look at a causal relationship, we need to have already looked at the relational or the correlational piece, and we also need to have some descriptive information about the phenomenon to start with. This is a method that I found when I was looking at how can I help students understand how to create a research question. I found this on a site called research.com, and it's called the Finer method. And it has the words, we'll start with feasible. A good research question is feasible, meaning it's something within my ability to investigate. So what I was talking about earlier about researchers, especially newer researchers, try to bite off more than is possible in one particular study, trying to answer too many questions. You need to make sure you're biting off a chunk that you are able to complete within your study and be realistic about what your study can find. In other words, don't say your study is going to look at causation when you know you're really only going to be able to look at differences between the means, or when you're only going to be able to look at correlation. Maybe because of the size of study, maybe because of the scope of the study. It's also good to have a contingency plan in place if you get into the study and you find out, oh, I couldn't recruit as many people as I want. How can I step it back and still do a study that is feasible? It should also be a topic that is interesting not only to the researcher, but to the peers and to the community at large. So if I'm asking intervention questions in occupational therapy, that's an interesting question. What's going to best help my patients? Doesn't mean that it's always interesting to everybody, because we researchers tend to be of nerdy sorts, right? We're trying to find out specific details about things. But sometimes getting people excited about your motivation, about the research problem, makes the research study an interesting study. The N of finer is novel. It should be something that hasn't been done before, or if it is something that's been done before, you should be doing a new twist on it, maybe with a different population, or maybe it's just a different time period, or maybe it's with a larger group of participants. Something novel that's bringing new insights to the field. As we talked about last week, it should also be ethical. This is one of the most important considerations as we're going through our methodology. We need to make sure that the study that we're creating is going to be ethical, something that review boards are going to approve, and that is going to be viewed as an ethical study in the larger community. And relevant. Okay, so it needs to be feasible, interesting, novel, ethical, and relevant. So the research question needs to be relevant to the scientific community. It could be an interesting factoid, but if it's not relevant to, say, improving the state of our clients, then maybe it's something that is not worth our time as a research interest. It needs to be relevant to the public's interest or to the community's interest, such as the community of occupational therapists. All right. How does the PICOT question that we use for our literature review relate to the research question? Well, there are similarities, but they're not the same thing. So in this case, this is an example of a research study that I did, and our PICOT question that we used to search the literature was how were occupational therapist practitioners, so OTs and OTAs, during COVID-19 perceiving the type of moral distress that they were experiencing in practice. So we were looking at the literature to see if there were things already out there saying how people had survived, had they experienced, what kind of moral distress were they having during this COVID-19 period. And there wasn't a lot out there because everything was so fresh and new. We embarked on this endeavor in the fall of 2020. So as we were researching the literature, it was kind of being published as we were doing it. So, but that was the question. What's out there already on the moral distress that OT practitioners are experiencing? And we broadened that a little bit since there wasn't a lot in OT, and we also looked at nurses and other healthcare practitioners, and we also looked at moral distress as a general experience of occupational therapists kind of prior to COVID times. So when we got to doing our research question, then we narrowed it down even more and said not just the perceptions, but what's the experience? Not only are they what they thinking about moral distress, but how have they been experiencing moral distress in practice since the onset of the COVID-19 pandemic. So it's a little more specific and a little bit more getting at exactly what it was we were doing in the qualitative study that we were carrying out. So here's examples of the difference between quantitative and qualitative research questions. A quantitative questions might be how have school intervention programs and parental education levels affected the rate of childhood obesity among 1st to 6th graders? So comparing parental education levels, school intervention programs, and childhood obesity as different variables in terms of how do those correlate with each other. Qualitative, I might ask what has been the experience of children in grades 1 through 6 who are obese in socializing with peers as told by the children and their parents. Two very different research questions. They both deal with childhood obesity. They both might be part of the same long-term research agenda, but they're different questions at getting at looking at the same problem from different angles. So that's maybe how we can differentiate quantitative and qualitative research questions. So in conclusion, With the research problem, you want to start with a broad problem and kind of narrow it down, like that funnel that we've talked about previously. The research question is going to be narrowed down even more to what's the little bite that we can get in this particular study. We can use PIOT, or PICO formats to help us keep it specific and clear, but it's not the same as our our literature search question. The research question is not going to be the same as the literature search question. We write a purpose statement or an aim that helps us to investigate that question, and then we write our hypotheses for what we think will happen or what we think we will find if it's appropriate to the type of study that we have chosen. I have provided some examples of these different types of questions in some documents on our lab section of our Brightspace course site, so you might want to take a look at those if you need some more examples. We're going to be looking in class at some examples, but you can take a look at these little snippets and see if you can figure out from these what would be the problem, the question, the purpose, the hypothesis, and what kind of research design were the researchers using. So here's one example. Here's another example, this one being a qualitative study, and yet a third example. So we'll take a look at these and let you practice on parsing out those pieces. All right, thank you. See you soon.